Here's how to quickly tell nephrolithiasis from pyelonephritis using the urinalysis. Nephrolithiasis or kidney stones, think sudden, unilateral, colicky flank pain that may radiate to the groin. These patients get CVA, tenderness, often microscopic hematuria, and maybe mild dysuria. On the UA, the findings are usually minimal because there's no infection, just mechanical irritation from the stone. Protein, negative. Red blood cell cast, negative. RBCs can be, in this example, are 5 to 7 per high power field. The stone scrapes the ureter or the kidney, causing small amounts of bleeding. White blood cell casts are negative. There's no inflammation inside the tubules. White blood cells can be 1 to 2 per high power field, which indicates maybe a mild irritation, but nothing infectious. So the classic picture is pain plus microscopic hematuria with no signs of infection. Now compare that with pyelonephritis. These patients are going to look sicker. They're going to have fevers, chills, constant flank pain, dysuria, frequency, urgency, and the urinalysis is going to tell us the story. Here's an example of a typical urinalysis of a patient who has pyelonephritis. Protein is 1+. There's inflammation that increases glomerular permeability, giving us the protein finding in the urine. Leukocyte esterase, positive. White blood cells release this enzyme when they flood the urinary tract. Nitrites in this example are positive. Enterobacteriaceae convert nitrates to nitrites. So if the patient is infected with the Enterobacteriaceae, nitrates are going to be positive. Red blood cells are around 2 per high power field. There's inflammation around the kidney that can irritate nearby vessels, giving us red blood cells in the urine. White blood cells are, in this example, 90 per high power field. This is considered clinically significant if more than 5 white blood cells are visible per high power field on urine microscopy. Classic pyuria from a strong immune response. White blood cell casts in this example is numerous, so this is going to be the key, okay? Infection has ascended into the renal tubules where white blood cell casts form. So this is, if you have white blood cell casts, then that means that we have the infection in the kidney, so this is pyelonephritis. Those white blood cell casts are going to be the giveaway. They confirm kidney involvement, not just a lower urinary tract infection. Here's a quick recap for kidney stones. Patients are going to have pain, and we're going to have microscopic hematuria from mechanical irritation with a clean urinalysis otherwise. In the case of pyelonephritis, patients can have fever, flank pain, and a UA showing infection markers. Positive leukocyte esterase, nitrites, tons of white blood cells, and white blood cell cast from tubule inflammation. That's how you can instantly separate nephrolithiasis from pyelonephritis on urinalysis.